Welcome to my channel. If you're interested in staying healthy, preventing disease, and enjoying a longer, more active life, you're in the right place. Have you ever found yourself feeling unusually thirsty, more tired than usual, or making extra trips to the bathroom, and simply assumed it was because you're getting older? You're certainly not alone. Many people dismiss these small changes as a normal part of aging, stress, or a busy lifestyle. But in some cases, these seemingly harmless symptoms may be your body's early warning signs that your blood sugar is becoming harder to control. The truth is that blood sugar problems rarely develop overnight. For many people, the body quietly sends signals months or even years before type 2 diabetes is diagnosed. Unfortunately, these early signs are often subtle, making them easy to overlook. In today's video, we'll uncover the hidden blood sugar symptoms that often appear before diabetes. You'll learn why they happen, what they may mean, and simple lifestyle habits that can help support healthy blood sugar. Most importantly, you'll discover when it's time to speak with a healthcare professional. So stay with us until the end, because one of the most surprising warning signs has nothing to do with eating sugar, and many people completely miss it. Before we look at the first hidden symptom, it's important to understand what's happening inside your body. Knowing this simple process will make all the other warning signs much easier to recognize. Every time you eat foods containing carbohydrates, such as bread, rice, fruit, potatoes, or even milk, your body breaks them down into glucose, which is your body's main source of energy. To move that glucose from your bloodstream into your cells, your body relies on a hormone called insulin. Think of insulin as a key that unlocks the doors of your cells, allowing glucose to enter and provide energy. But over time, especially with aging, excess body weight, inactivity, poor sleep, or family history, your cells may stop responding to insulin as well as they once did. This is known as insulin resistance. When that happens, glucose begins to build up in the bloodstream, instead of reaching your muscles and organs where it's needed. The pancreas works harder by producing even more insulin, but eventually it may struggle to keep up. This silent process can continue for years before diabetes is diagnosed, and during that time, your body may already be sending subtle warning signs that many people overlook. In the next section, we'll explore one of the earliest and most common symptoms that often appears long before people realize their blood sugar is rising. The first hidden symptom many people notice is feeling unusually thirsty. At first, it may not seem like a big deal. You might think it's because of hot weather, spending more time outdoors, or simply not drinking enough water. But if you find yourself constantly reaching for another glass of water without a clear reason, your blood sugar may be worth checking. Here's why this happens. When blood sugar levels become too high, your kidneys work overtime to remove the extra glucose from your bloodstream. Glucose doesn't leave the body alone. It pulls water with it. As a result, your body loses more fluids than normal through urine. This gradual loss of water can leave you feeling dehydrated, even if you're drinking regularly. Think of it like trying to fill a bucket with a small hole in the bottom. No matter how much water you pour in, some of it keeps leaking out. That's similar to what happens when excess glucose causes your body to lose water. Of course, feeling thirsty doesn't automatically mean you have diabetes. Certain medications, hot weather, exercise, or other medical conditions can also cause dehydration. However, if excessive thirst continues or appears alongside other symptoms, it's a good idea to discuss it with your healthcare provider. Next, we'll look at another warning sign that often appears at the same time, and many people mistake it for a normal part of aging. Another early warning sign that often appears alongside excessive thirst is frequent urination, especially during the night. Many adults assume that waking up 2 or 3 times to use the bathroom is simply a normal part of getting older. While aging can affect bladder function, it isn't always the whole story. When blood sugar levels become too high, your kidneys have an important job to do. They act like your body's natural filtration system, constantly cleaning your blood. But when there's too much glucose in your bloodstream, Your kidneys can't reabsorb all of it. Instead, they remove the extra glucose through your urine. As that sugar leaves your body, it pulls water with it, causing you to produce more urine than usual. This can create a frustrating cycle. You lose more water, which makes you feel thirsty. You drink more water to satisfy that thirst, and then you need to use the bathroom even more often. Over time, interrupted sleep from repeated nighttime bathroom trips can also leave you feeling tired and less energetic during the day. Of course, frequent urination can also be caused by drinking large amounts of fluids, certain medications, urinary tract infections, or prostate problems in men. But if this symptom is new, persistent, or appears together with unusual thirst or fatigue, it's worth discussing with your healthcare provider. In the next section, we'll explore another hidden symptom that many people mistake for simply having a busy day. Another hidden blood sugar symptom that many people overlook is feeling tired all the time, even after getting what seems like a full night's sleep. If you've been waking up exhausted, struggling to stay focused during the day, or feeling like your energy disappears by the afternoon, your blood sugar could be playing a role. This happens because your body's cells depend on glucose for energy, but glucose can't enter the cells efficiently without enough insulin, or when your cells become resistant to insulin. Even though there's plenty of sugar circulating in your bloodstream, your muscles, brain, and other organs aren't receiving the fuel they need. It's almost like having a full tank of gasoline but a clogged fuel line. The energy is there, but it can't reach the engine. High blood sugar can also cause dehydration through frequent urination, and poor sleep from waking up multiple times during the night can make fatigue even worse. Together, these factors can leave you feeling drained and less productive throughout the day. Of course, fatigue has many possible causes, including stress, anemia, thyroid disorders, poor sleep, or certain medications. But if persistent tiredness occurs alongside increased thirst, frequent urination, or other symptoms we've discussed, it's wise to schedule a medical checkup. Up next, we'll reveal another surprising warning sign that often appears in your eyes before many people realize their blood sugar is changing. Another hidden symptom that often appears before diabetes is blurred vision. Many people assume they simply need a stronger pair of reading glasses or that their eyesight is naturally getting worse with age. While aging can certainly affect vision, sudden or ongoing blurry vision can sometimes be linked to changes in blood sugar levels. Here's how it works. When blood sugar becomes too high, it can cause fluid to move in and out of the tiny lens inside your eye. This changes the shape of the lens, making it harder to focus clearly. As a result, objects may appear blurry, reading small print may become difficult, or your vision may seem to come and go throughout the day. Imagine looking through a camera lens that keeps changing its focus. Sometimes the picture looks sharp, and other times it's blurry. That's very similar to what fluctuating blood sugar can do to your eyesight. Of course, blurry vision doesn't always mean you have diabetes. It can also be caused by cataracts, dry eyes, eye strain, or other eye conditions. But if your vision suddenly changes or becomes blurry along with increased thirst, frequent urination, or constant fatigue, don't ignore it. An eye examination and a blood sugar test can help identify the cause. In the next section, we'll discuss another surprising symptom that often shows up on your skin before diabetes is diagnosed. Another hidden blood sugar symptom that many people don't connect to diabetes is slow healing cuts and wounds. Have you ever noticed that a small scrape, a shaving cut, or even a minor blister seems to take much longer to heal than it used to? While healing naturally slows a little with age, persistently slow wound healing can sometimes be an early warning sign of elevated blood sugar. Your body depends on healthy blood circulation to deliver oxygen, nutrients, and infection-fighting cells to injured tissues. When blood sugar remains high over time, it can damage small blood vessels and reduce circulation. This means fewer of the body's natural healing resources reach the wound. High blood sugar can also affect the immune system, making it harder for your body to fight bacteria and repair damaged skin. Think of it like trying to repair a house without enough workers or building materials. The repair eventually happens, but it takes much longer than it should. Of course, slow healing doesn't always mean diabetes. Poor circulation, certain medications, nutritional deficiencies, or other medical conditions can also delay recovery. But if you notice cuts, sores, or blisters that don't improve after several weeks, especially when combined with thirst, fatigue, or frequent urination, it's important to speak with your healthcare provider. In the next section, we'll discuss another surprising warning sign that often appears on your skin before many people suspect blood sugar is involved. Another hidden blood sugar symptom that often goes unnoticed is frequent skin infections and persistent itching. Many people assume dry or itchy skin is simply caused by colder weather, aging, or using the wrong soap. While those can certainly be factors, ongoing skin problems may also be linked to rising blood sugar levels. When blood sugar stays elevated over time, it can affect your body's natural defenses. High glucose levels create an environment where bacteria and fungi can grow more easily. At the same time, reduced circulation and changes in the immune system make it harder for your body to fight these infections. You may notice itchy skin that doesn't seem to improve, recurring fungal infections, or small skin irritations that take longer than usual to heal. Some people also experience dry, flaky skin because high blood sugar can cause the body to lose more fluids, leading to dehydration. Think of your skin as your body's protective shield. When that shield becomes weaker, it's easier for germs to enter and cause problems. Of course, skin infections and itching can have many causes, including allergies, eczema, dry weather, or other medical conditions. But if these problems keep returning, especially alongside increased thirst, fatigue, blurry vision, or frequent urination, it may be time to talk with your healthcare provider and consider having your blood sugar checked. Next, we'll discuss another surprising symptom that many people never associate with diabetes until it's diagnosed. Another hidden symptom that many people never connect to blood sugar is feeling unusually hungry, even after eating a meal. You may finish breakfast or lunch only to feel hungry again an hour or two later. Some people even notice stronger cravings for sweets or sugary snacks, making it difficult to resist reaching for another bite. This happens because, although there's plenty of glucose in your bloodstream, it isn't entering your body's cells efficiently. Remember how we compared insulin to a key. When that key doesn't work properly because of insulin resistance, your cells are left without the energy they need. As a result, your brain receives signals that your body still needs fuel, even though there's already plenty of sugar circulating in your blood. Think of it like having a pantry full of food, but keeping the door locked. The food is there, but you can't access it. That's exactly what your cells experience when glucose can't get inside. Of course, increased hunger can also be caused by stress, lack of sleep, certain medications, or a very active lifestyle. But if constant hunger occurs together with unusual thirst, fatigue, blurry vision, or frequent urination, it's worth talking with your healthcare provider. In our next section, we'll discuss one of the most surprising warning signs of all, a symptom that often begins in your hands and feet long before diabetes is diagnosed. As we've seen throughout this video, your body often gives you quiet warning signs long before diabetes is diagnosed. Whether it's unusual thirst, frequent urination, constant fatigue, blurry vision, slow healing cuts, itchy skin, increased hunger, or tingling in your hands and feet, each of these symptoms may be your body's way of asking for attention. The important thing to remember is that having one of these symptoms doesn't automatically mean you have diabetes. Many of these changes can have other causes, but when several of them begin appearing together or continue for weeks, they shouldn't be ignored. The good news is that prediabetes and early blood sugar changes can often be managed with healthy lifestyle habits. Eating a balanced diet rich in vegetables, whole grains, lean protein, and fiber, staying physically active, maintaining a healthy weight, getting enough sleep, and scheduling regular health checkups can all play an important role in supporting healthy blood sugar. Most importantly, don't wait until symptoms become severe. Early testing and medical advice can make a significant difference in protecting your long-term health. Thank you so much for watching today. I hope this video has helped you better understand the hidden warning signs that may appear before diabetes develops. Now we'd love to hear from you. Which symptom surprised you the most? And tell us your age and the country you're watching from in the comments below. Your experience could help someone else in our community. If you found this video helpful, please consider liking the video, subscribing to the channel, and turning on notifications so you never miss our future videos on healthy aging, disease prevention, and living a longer, healthier life. Thank you for watching, take good care of yourself, and I'll see you in the next video.